Hi, welcome to Atmas First, a guide to the science and art of aging healthfully. This is the companion website to the book, which was published 4 months ago and lists the 15-point guide to live long healthy, though the website started in December 2020 and predates the book. I am Bhavin Jankaria. I'm a radiologist and physician in practice for the last 30 odd years. The aim of Atmas First is to understand how to live long healthy as far as possible without being dependent on the healthcare system. The site is free, but to read some of the articles, you might need to subscribe with your email ID. And here's the QR code in case you need to just get to the site. So today's topic is titled Thriving After 55, Staying Healthy and Preventing Major Health Risks. And this is basically based on the data from the Global Burden of Diseases 2021 and how it all affects us. The GBD data was published over the last 3 to 4 weeks. And one of those was the curve on longevity. And except for the dip because of COVID-19, you can see that in every country in the world, in every socioeconomic strata, people are just living longer. So longevity is inevitable. But the question really is that when people fall sick or when people die, what are the common causes that we have? So I looked at the data from the GBD for people over the age of 55 in India, excluded COVID-19, and asked ChatGPT to create this bar chart from the raw data. And you can see the common causes of death here, starting with ischemic heart disease, which by far is the commonest cause of death in India. And then you have chronic obstructive pulmonary disease, stroke, cancer, and the rest. Now, each of these conditions is caused by many risk factors. So, for example, ischemic heart disease and stroke, the first and the third biggest killers, can occur because of a combination of air pollution, high blood pressure, high HDL, LDL levels, smoking, diabetes, and poor food habits. So if you look at those risk factors, what we did is we looked at the conditions causing death. Here are the risk factors that cause death in 55 years and older people in India. And you start with air pollution, which again is the most common, and then high systolic blood pressure, dietary risk, tobacco, etc. Now, what is it that we can do to reduce these risks? I mean, for air pollution, it's very difficult. There's not much we can do for that, for other environmental risks, for non-optimal temperature. But for many others, there's a lot you can do. And I've just put that in perspective. And I had spoken about this in the earlier video as well, that what I do is in the center. And then you have a whole lot of other factors that perhaps we don't always have control over. And while this circle appears very small, it has a huge impact. And so while we may not have control over our environment, surroundings, and government systems, we do have control over what we do. So for example, risk number 2, high blood pressure. You can measure your own blood pressure using some very good instruments available in the market. Do it at regular intervals, at least once a year. And if it's high, see a doctor and start measures to bring down the systolic blood pressure. Risk number 3, dietary risks. Eat sensibly, right? With control over salt and sugar. Remember, a little extra weight is far better than being malnourished. Risk number 4, tobacco. I mean, there's just no argument here. Do not smoke and do not chew tobacco. Risk number 5, high fasting plasma glucose. You can get this measured yourself. So while this is not about using the sticks, you can get a path technician at a minimal cost to come to your house if you don't want to go to a path lab, draw blood, and measure your plasma glucose. And if it's high, forget the pre-diabetes stuff, which is often rubbish. If it's really high, then go to a doctor to start measures to bring these under control. Similarly, risk number 6, if you have high blood pressure or diabetes, then you may be at risk for kidney dysfunction and you should check your serum creatinine level. High LDL cholesterol, the time when you give your blood for plasma glucose, give it for lipid levels as well. Unsafe water, sanitation, and hand washing is quite simple and straightforward. Wash your hands before and after using the toilet and before and after eating, and then drink boiled or filtered water. Risk number 10 is high body mass index. And again, here, remember that being fit and so-called overweight is far better than being unfit and so-called normal weight. So you don't want to be at the extremes, but if you're 27, 28, 30, that's fine. That's not an issue. Low mineral bone density is here at 13. So to improve your bone density, the best way is physical activity. But to measure it, then at age 60, if you're a woman, then you can do a bone density study. And alcohol use, do not drink, but if you do, then do so sensibly. So what we do, physical activity, including good cardiorespiratory fitness, eating sensibly, salt and sugar control, sleeping well, not falling, not smoking, not drinking or drinking in moderation, taking vaccines, managing our senses, calming our minds and building cognitive reserves. These are the things that we can do, and they make a huge difference. So those were the risk factors as mentioned by the GBD and what we can do with them. Over and above those, you have these others that make a difference. And perhaps the single most important intervention that improves our health span and lifespan is physical activity, then taking vaccines, not falling, sleeping well, managing oral hygiene, vision and hearing, and calming your minds and building cognitive reserves. And remember, all of these things you can do on your own. For oral vision and hearing, you do have to visit a dentist or an audiologist or an optometrist, but you can make the effort to do so yourself, right? And these are important, and these will help us live long, healthy. Over and above that, if you go for an annual health checkup, then these are the things that help. Physical, laboratory, and you can do a screenshot here, and ECG after 65, annual mammogram, HPV DNA, etc., etc. And all of these are listed here. Do not do additional unnecessary testing, because you can always find something, and that will lead you down a rabbit hole of unnecessary testing, sometimes even unnecessary treatment. For example, you do an ultrasound abdomen, somebody finds a gallstone, you're asymptomatic, you'll still in this country be advised a laparoscopic cholecystectomy. And don't forget that every surgery like that comes with some possible complication or some adverse effect. And you don't want people messing around in your body for no reason at all. So that is the whole gist of why Atmaswast, because being healthy is much more than mere absence of sickness. You have to make a positive contribution to your own health, because it's your responsibility and no one else's, and because no one but you can ensure that you live a long life healthy with a long health span and lifespan. And it comes back to this. So while we will all live long, because longevity is inevitable, many of us will live diseased lives with pain and suffering, which we don't want to do, because what we need is a long health span. Within that long lifespan, which is the period of time without a major illness, a chronic disease, or disability. And as you can see, this cartoon by Morparia, which is like a koan, you can maybe pause the video here and go through this in detail. And this person goes to this, searching for the guru, and when he goes to the guru says, I have to pee. And this person thinks that that's the message, that you have to do this for yourself. And that's why Atma Swast, Atma equal to self, Swast equal to health. The book has all of these things in detail. In case you don't want to use the website, remember the website is free. And if you subscribe, you get an article in your inbox every 7 to 10 days that will help. And there are no other hidden things that will be there. It's all always going to be free. But if you do want something tangible in your hands, then there's a book, and there's a cost to buying the book. Thank you so much for listening to me, and wish you a long health span, a great day, and a great week as well.